Good morning, everyone. I hope you had a great night's sleep and that you are ready for the second day of the Focus Conference here in Stockholm. I'm speaking to you from Brussels, and it is an absolute delight to be welcomed back to the edition of 2025. Thank you so much for your kind invitation. I'm very sure yesterday you already started discussing and tackling all the new experiences and challenges of our world since we last met here. But I am also convinced that the message, the core, it's still the same. And it is called people centered healthcare. And in cancer care and in Europe, that always and still starts with tackling Europe's Beating Cancer Plan in 2025. So let's start together with you answering the first question of the morning. Has the Europe's Beating Cancer Plan helped to improve patient outcomes? But first, if you may allow me, I would like to have a quick introduction about ourselves. What is ICO? And of course, I will start with the mission. The mission of the European Cancer Organization is to be the united voice of the cancer community in Europe and beyond. We care a lot in our mission about improving the quality of care for all cancer patients throughout the most powerful mechanisms of multidisciplinarity and multiprofessionalism. Of course, we have a big table. I like to say that we have one of the biggest tables in cancer care in Europe as we convene oncology professionals and patients to agree policy on cancer and to advocate for positive changes in the cancer mission. Of course, this is very well aligned with our vision to be a vibrant and proactive federation working together with you for a cancer-free future of the European society. In our vision, we practice actually the creation and development of relationship between European institutions and the European cancer community, of course. And I would say that our most important mission, vision, and business is to facilitate collaboration and to search consensus towards tangible and impactful cancer policy improvements. I'm very sure if you take a look at this slide with the ECO member societies, professional societies, you will find your one or the one that you're working with closely. These are the most important professional societies in a very comprehensive sense across the board. And after this short introduction about ECO from Brussels, I would like to take out the balance in front of you. And mind me, please, that I'm a psychologist and I would like to start with the positive results, at least a flavor of what has been achieved from Europe's Beating Cancer Plan starting from 2020 up to now. So let's dive in. First of all, I would like to start with prevention. We have world-leading cancer prevention legislation in Europe. And just let me give you a few examples: ambitious new limits on air pollution, new legal protections against known carcinogens, and of course, an updated EU recommendation on smoke and aerosol-free environments. All of them connected to the cancerogenesis. And legislation can be a powerful tool in cancer prevention, as powerful as it is vaccination. We have witnessed major steps in HPV cancer elimination in Europe during the last years. Actually, the EU is leading the world on HPV elimination thanks to Europe's Beating Cancer Plan. And more EU countries are now politically committed to gender-neutral HPV vaccination. And we must stand strong on cancer elimination through vaccination. It's HPV and other cancers related to preventable side of the spectrum with vaccination. Screening, it's very important when we are talking about outcomes, personal and as a society outcomes. We are advancing quite well in cancer screening in all the European countries. And I can tell you, as someone coming from Romania, that it was the first time that we had piloted screening programs for cancer. And this is also happening across Europe. And that's also thanks to the budget that was attached to the Europe's Beating Cancer Plan. Also, I think that it's very important to highlight that there is a growing EU guideline to help guarantee the quality of the screening. Because the quality of the screening also means for the patients better chances. And here I must mention the Cancer Image Europe platform, which is advancing cancer research based on the screening of the people. And we have something quite European that we have been advancing well, and there is something that we should be really proud of. It's a meaningful right to be forgotten movement. And just as a kind reminder, in 2019, just 1 year before the Europe's Beating Cancer Plan was launched, 2 countries provided protection against financial toxicity in Europe. Today, 9 countries offer legally binding protection, and 6 countries follow non-binding guidelines. So certainly there is a growing recognition of the RTBF, right to be forgotten, European approach on this. And the world is watching us on the right to be forgotten, and there is something that we should really power up and empower. And I promised you a balance. And on the other side of the balance, I would say that there are not necessarily the negatives or the mixed things, but I would say that they are the upcoming projects category. Like, for example, I think for us, the most important one of them is the new edition of the European Code Against Cancer, which is, of course, an international benchmark by now in the understanding of modifiable cancer risks and also of personalized cancer risks. So the European Code Against Cancer, as we know, in featuring collaboration with the World Health Organization, focuses on actions that we, individual citizens, can take to help prevent cancer. And the new edition is coming up. Also, the forthcoming reviews of the tobacco legislation in Europe. I think that's very important, as we have this ambition in Europe of creating a tobacco-free generation by 2040. And the tobacco industry, it's doing its share, so we should also do this. And I think we should also synchronize here with the main goal of the Europe's Beating Cancer Plan, having a smoke-free generation. Comprehensive cancer centers to all of the people in Europe affected by cancer. And this is in development with the new EU network of comprehensive cancer centers, CRANE. And we also have JANE 2. So building capacity and connecting cancer centers across the EU and beyond, it's still our job to do. As the main goal, as I mentioned, is to widen access to comprehensive cancer care. The European Interspecialty Cancer Training, Interact Europe 100. A total of 105 cancer centers in 25 countries are participating. This is again a new cross-border interspecialty cancer training program. And I think that education in cancer care, it's really something that is related to the cancer workforce as well, but also to be as people-centered in cancer care as possible. Also, we are leading in cross-border digital health development. Just let me mention here with my dear Polina, we have co-chaired the Smart Care project that we had the showcase event last year at the European Cancer Summit. Penila and myself and all the team have worked hard to develop this prototype of the app for the benefit of cancer patients. Of course, apps are also data sharing platforms, and these apps should be also used in order to upscale cancer skills of the cancer professionals, so training programs. The digital health, including the new AI developments, is really a very rich menu and a very rich future for having a more focused and a more people-centered cancer care in Europe. But of course, when we have a balance, we also need to ask the most important question. Through all the buzz, through all the fears, through all the risks, where should we focus now? After that, we know who we are, we know our mission, we know what we want together as a cancer community in Europe. We have a sort of balance, a tacklement of the Europe Speeding Cancer Plan, looking back for 4-5 years. So I would say that there are 3 keywords here. The first focus is on fulfilling the Europe Speeding Cancer Plan. We cannot stop, it's not checked, it's not done yet, we still have work to do. Please, it's the best moment to speed up collaborations. A second keyword is refreshing the Europe Speeding Cancer Plan for new developments in science. Oncology is one of the most spectacular advancements in science in general. And the third keyword is expanding European goals on cancer control. So this should be in our focus together with the opportunities that are here with us with the new EU and Animal Wellbeing Commissioner Várhelyi Oliver. One of the opportunities is to have a linkage, a strong one, and here again Penilla Günther is a wonderful example, working on both sides but with the same heart of having a people, person-centered care. So the linkage with the forthcoming cardiovascular health plan that is due next year and where the cancer control plan can be a very, very good model. And also the opportunities of addressing long-standing health and oncology workforce shortages that we, face and struggle with or have been struggling with in the last years. So we need focus, and we need to have focus also on the opportunities that are arising. So before I finish, here we have 10 proposals for you. We have 10 focused NOPIC networks at the European Cancer Organization, and we are looking forward to work together more closely than ever to be in focus and also to know how to tackle the new challenges, opportunities and crises. So we have prevention, early detection and screening, HPV and Hep B action, health systems and quality cancer care, research policy, survivorship and quality of life. Please make a picture and just give yourself a second to think about your preference. Which one do you like? Where you would like to work with us together? Digital health is the next. Inequalities network, workforce network, and emergencies and crisis focused topic network. These are our 10 proposals for you. And we are looking forward to continue working together. Our working groups are open to you. I just mentioned meeting the new EU Health Commissioner. The European Cancer Organization was the first to be officially invited to meet Várhelyi Oliver on World Cancer Day this year. And a full report from this meeting is on our website. Make sure you read it. And also make sure that you are going to meet us at the European Cancer Summit in November this year, as the new EU Health Commissioner and our cancer community from Europe is going to discuss and collaborate on much deeper level on these cancer-related issues. And this is the end of my presentation this morning. Thank you so very much for your kind attention. And also, I would like to wish you a great conference today. See you next time.